commence our today's webinar, that is Target EDIC 2023. I am glad to welcome the faculty. It is such an honor for us to have you today between us. Thank you so much for bestowing us with your own presence, sir. Please welcome Dr. Asif Iqbal, sir. He is a senior consultant in Department of Respiratory Critical Care and ECMO services at Apollo Multispeciality Hospital in Kolkata. And his area of interest is in respiratory critical care, ECMO services, followed by Dr. Ehsan Ahmed. He is a Chief of Critical Care and Emergency Services at KPC Medical College in Kolkata. His area of interest are in sepsis, mechanical ventilation, and advanced hemodynamic monitoring. Now, I would request Dr. Ehsan Ahmed, sir, to start the webinar, followed by Dr. Asif Iqbal, sir. Over to you, sir.
Dr. Ehsan is a senior consultant and head of the department in KPC Medical College. Already, Ms. Fatma has introduced, but he is also involved this teaching faculty in EDIC for last 5 to 6 years, and he is a very good teacher, and also his not only teacher, he has a chapter and different books in critical care field. And I will request Dr. Ehsan, because he one of the person who tried to bring EDIC 1 exam in Kolkata. So he was associated with EDIC, European Society of Critical Care Medicine, since long back, since 2013-2014. So you will have a good experience about the exam. He has a vast knowledge about the exam pattern, how its pattern changing, and what are the domain where you have to focus more, and what are the thing, how the examiner choose a question, and when you will see the question, what is the exact keyword and what exactly examiner want to know in your part 1 and also in your part 2. So today we will restrict our lecture on part 1. So I will request Dr. Ehsan, you start.
Thank you, Dr. Asif, for the nice introduction. Good evening, everyone. All the EDIC aspirants, those who are going to give the exam in this session of April 4, 2023, or who are the aspirant candidates who wish to give this exam in the next sessions. So in this brief webinar, we will discuss about the introduction of the EDIC. What is this EDIC examination about? Then objective of this EDIC examinations, the eligibility criteria, who can sit for these exams, then exam seasons, about the syllabus of the exam, what to read, how to read, the structure of the exam, the part 1, part 2, the part 1, how questions comes, then about the document for the applications, books for guidance, and lastly, Dr. Asif will tell you about how Farz Academy will help for your preparations. Next, please. So, anyone having interest in EDIC examination, that is the European Diploma in Intensive Care, you can go directly to this ESICM website, that is the www.esicm.org. Here you can get all the information about the part 1 and part 2, about the fees, about the required qualification for sitting in this exam. So you will get everything here. Next, please. So the objective of EDIC exam was with the idea of increasing the knowledge and making the knowledge as a standard practice. So that's why this examination it is a exit examinations developed by the European Society of Intensive Care Medicine. So when they come with the idea of this exam, they want that every intensivist should have a basic knowledge that give the patient a safe practice. It will not make the patient harm. So with this basic idea, they have started formulated this exit examination to standardize the quality of the new intensivist, who should have at least the standard knowledge, skills, as well as their ability to diagnose and manage different cases that comes in the intensive care. Only the pediatric ICU and neonatology ICU is not covered. So it is about a adult intensive care practice. So about the knowledge upliftment, skill development, and ability, and then these examinations, once you clear this examination, you are certified EDIC. So you have a lot of job opportunities throughout the European center, European countries. It is accepted. Recently, GMC, that is the UK Medical Council, they have recognized this degree as a directly you can get a job by doing EDIC. You can directly register in the GMC by if you have EDIC. So it is not still recognized in Indian Medical Council, but possibly it will be included in the future as well. Next, please. Next slide, please. So for part 1 as well as for part 2, the criteria is first you have to be a fully registered medical doctor. You have to have completed your internship certificate. Whose mic is on, please switch off your mic and go to a mute. Okay. So
I will request host, please switch off the all participant mic for the time being. We will give them opportunity at the end of the slide presentation.
Okay, then first you have to be a medical graduate, and secondly you have to have entry into or completion of a national training program in a primary specialty. And thirdly, you have to have entered into a national training program in intensive care medicine or satisfactory completion of 18 months training in intensive care medicine. And or if all are 1 to 3 are fulfilled, if intensive care medicine recognized as a primary specialty. So you have to have a postgraduate degree in either anesthesia, medicine, chest medicine, like that. And also, if you have a critical care degree, that is a critical care recognized certificate course or degree, then you are also eligible, provided you have an 18 months of training in the intensive care medicine. Next, please. So the exam is conducted twice per year. One is the spring session exam, that is either in April or May. As you all know, this year it will be done on 4th of April. And there is an autumn session or spring session, autumn session, that is usually done in the September or October. This year probably it will be done on 26th of September. So who have not applied for, you can apply for the autumn session. And those who have already applied, I think you all know the dates. So it is usually in April or May, and autumn session is on September or October. And nowadays, previously it was on-site examination, that is, it was given on a center, but till the COVID, it was become a online examinations. So in online examination, what they will do, once you selected for the exam, and on the day of examination, you have to sit on a single room where no one is allowed. You have to have a camera, microphone, and a stable internet connection with a computer. The exam is not being allowed to run in any notepad or mobile. And the proctor will see you whether there is anything in the room or not. So they have a list of unauthorized items that cannot be used. So from anywhere in the world, sitting anywhere, you can give this examination, as part 1 is carried as a online examinations since the COVID era. Next, please. So the syllabus of the exams is total 15 domains are there. It is a standard syllabus of any intensive care medicine courses. From general physiology, pathophysiology. It can come from diagnosis and management of general medicines. Then there will be some domain about the ethics, then medical legal ethics, then end of life care, like that. Then quality of ICU indicators. So these are the common domains. So 15 domains are there. First is general topic, that is for any systematic diseases, then acute coronary care, respiratory medicine, gastrointestinal emergencies, renal diseases, neurological diseases, endocrine disorder, obstetric emergencies, infectious disease, trauma, toxicology, hematological malignancies, nutrition, ABG fluid electrolytes, and eventually end of life care and brain death. And some medical statistics is also included, very simple statistics like type 1 or type 2 error, calculating the positive value or predictive value or negative predictive value, sensitivity, specificity, like that. Next, please. So the part of exam is a multiple choice questionnaire examination with 100 questions. So you have 100 questions and you have 3 hours to answer all the questions. And there is no negative marking. That is very important. You can choose all the, even if you don't know, just put to score more. There is no harm in giving a wrong answer. Next, please. Now coming to the question patterns, there are 100 questions of 3 hours duration, and you have 2 types of questions. One is type A questions. That is in type A, there is usually 65 to 70 type A questions. They are single answer questions. So they have 4 or 5 choices. There are some questions where you get 5 choices like MRCP exam. There are some A type questions you get 4 multiple choice. So you have to give only one answer. And there is K type questions where you have 4 options only, A, B, C, and D, and you have to mark either true or false. And the K-type questions are 30 to 35 in numbers. The concept of A-type and K-type is that in A-type, you have a broad-based questions. Like for suppose, they have given the criteria for SARS. So they put heart rate, respiratory rate, oxygen saturation, BP, like that. And then the 5th one is something odd out of this actual 4. So that will be the answer. But in K-type, what will you get? They will give heart rate of 130 or 110 or 90, like that. So their concept is that in A-type, you have they will test you about what is your broad knowledge about the subject. And in K-type, they will give more specific questions to see how depth of knowledge is there in you. So that is why these 2 types of questions is being found. Next, please. So this is an example of a type A questions. If you see, a resident is measuring oxygen saturation using indirect calorimetry in a ventilated patient in intensive care unit as a part of a clinical study, and he wants to compare his measurement with the value. Then radial artery and pulmonary artery catheter are placed, and the following measurements are obtained. Hemoglobin 11.7, saturation is 97, like that. Then cardiac output in thermodilation method, assuming minimal contribution from dissolved oxygen. Which one of the following is the patient's calculated oxygen consumption? If you see the stem of this question, you can see there are 5 lines in the question. So usually question stem comprises of 4 or 5 lines. EDIC questions does not come like an MRCP questions, like a half paragraph questions or full paragraph questions, stems like that. So they have usually 4 to 5 lines of lines in one questions, and you have a choice of A, B, C, D, or sometimes A, B, C, D, E. And here, sometimes you have to carefully read the questions. You have to read the questions, right? Is it true, false? So the all except, or all are true except, like that. So the answer will be a single answer. Next, please. So this is an example of a type K questions, where again you can get a stream of 3, 4 lines, 5 lines maximum, and you have a choice of A, B, C, D, and you have to mark whether it is a false or true. Next, please. Next question, please. Next slide. So the marking is given, one question gives 4 marks. So if you in type A questions, if you make correct answer, you will get 4. If you make a wrong answer, you will get 0. But in K type, the marks are marks differently. Like that, if you correct 4 choices, that is true, false. If your all choices make correct, then you will get the full 4 marks. If you correct 3 questions, then you will given a half marks. So that is 2 marks for 3 questions making 3 choice correct. But if you correct 2 or less questions, then you will be given a 0. So you have to make all choices right to get the full marks. And if you choose at least 3, 75%, then you will get half mark. Next, please. So these are the document for application needed. So if you go to the website, you will get a details. So you need a short version of curriculum vitae, the letter of confirmation from national or regional primary specialty training authority, that is either from your college or the society or university, whatever. Then documents or letter confirming your training in ICM or completion of ICM training program. Either you are in training or you have completed your training, you have to give a letter regarding that. So if you are in ICM training, any critical care training like IDCCM, CTCCM, FNB, GNB, like that. So you have to give from your training institute, you have to give a certificate with training authority or supervisor or head of the training institute. And if you have completed your ICM training, then head of the department or head of the training program or other representative who can attest to your having completed the ICM training. And if you are a specialist, copy of the university related subjects. Next, please. So these are some books to guide for your exam. Whatever textbook, ISU textbook usually you read, like O's manual, then Washington manual. So there is no specific choice that you have to read this textbook for passing the EDIC examinations. There are a lot of textbooks in critical care. Any standard critical care textbook is available. For practicing MCQ, you can choose the Bennington Intensive Care Medicine MCQ, then OSCE for the final FFICM. So these are the choices. Also, you get this packed module. Once you register for the exam, you will get a free packed module for practicing the exam questions. So these are the upcoming dates for EDIC 1. For 4th April is the spring session and autumn session is 26th of September. Next, please. So now I request Dr. Asif to tell about how Farz Academy is helping to prepare for EDIC examinations. Already 2-3 batches have already passed and they have passed with very good marks. So request Dr. Asif to take.
Good evening. Actually, Farz Academy is a very professional and very much towards the exam. Till now, our success rate is more than 90%, and we prepare our student like from scratch to the success end, because this is one of the costliest exam. Nowadays, the registration fees around the outside Europe, it is 850 pounds. So nearly 85,000. So very costly exam. So you need to have a proper preparation and good preparation to go in a one go. You have to pass. So that's why what we did, we have our question booklet that contain around 2000 plus question to practice, And these are the real updated, real type updated question is there in our app. We do is our learning platform is a app based, and also we have a good LMS system website, and we have a regular doubt clearing session with the eminent faculty. This our faculty is either they done EDIC or they are associated with EDIC and other the high-end exam like DM, DRNB in India. And we also segregate our question like you go through the any good app like past test or past medicine domain wise question we have made for when you are studying the select your domain of cardiology, you will get the only cardiology question. And we have a ATI, KTI, both these things. And we have a tutorial, the live tutorial that is we name as a master class. And for a session, we give more than 50 plus tutorial session for our 6-month courses. We also give the 3 months courses, and regularly we our faculty discuss about the tips and tricks, and also our successful candidate take a session for our student. And we are starting the critical care group in our Facebook, where you can put your question, where our faculty, the successful candidate will be there. They will help you out for your difficult question and a difficult topic. Also, we have a more than 200 recorded lecture session, previous lecture session, topic-wise, domain-wise, topic, subtopic-wise video we have, where you can learn the things. Because nowadays, the thing is that audio-visual is more have impact. And when you are giving EDIC exam, either you are working in the ICU or working in the hospital. Some people are giving exam in a busy practice they have. So it is really difficult to read out the book, journal, and mug up it, where the audio visual recording will help you out, and our live session will help you out. And we take weekly mock test to explain the domain, the question, and also have a live debriefing session where you can clear your doubts. And also we do monthly mock test. The monthly mock test basically, the weekly mock test basically subject wise, like cardiology module is going on. So cardiology module exam. But when you are giving the monthly mock test, it is a 5 module together you are giving. So it is kind of revision, and also debriefing is the basically is clearing your doubt, clearing your the knowledge and upliftment of the knowledge, discussion on the some burning topics. And before exam, we do 2-day preparatory course that is for those who are appearing in the April session. We kept our 2 days prep course in the March 4th and 5th, where we will cover the all 15 domain, and we will choose some questions like that. This is very important subdomain area where question is coming. So you will have a real mock exam scenario, real exam feelings, and also you will have a good discussion with our best faculty regarding the how you will approach this question. And is today's webinar is just about how you will prepare yourself, and you have only roughly 1.5 months. So I will request all of you, those who are appearing, you You choose, you know what are the domain you have to cover. And next, if you join in our fourth and fifth, you will understand what are the subdomain you have to mug up, where from the question, what type of exactly question come. So the thing is that the exam is more or less the area where the question will come is a fix. The question will come in a different way. Sometime when the new management has come, new innovation has come, the question will come from that area. And remember that 50% of question you will get from the basic critical care, core critical care area from basic question. So that's why if you follow our guidelines, you will have a good chance to pass. And this is our website, that is farzacademy.com, where you can get the more information about the courses. And this is the fourth and fifth, where we are giving this crash course. It's a basically it's a prep course where we have an eminent faculty from all across the India. And the price is nothing, but it is just a token amount to appreciate our faculty's honorarium. We are trying to cover all the domain, and also we are giving 500 plus question to this updated question, where you will get the good good information in this question answer discussion, and the domain subdomain where you need to cover. And if you do registered before, you will get the all recorded session is a subject wise, topic wise, subtopic wise. That's about the Farz Academy, and Farz Academy will help you in a long run. And thank you. And now there is some question asked.
There was some
Doctor,
question asked in the chat box.
yes.
Yeah, so first question
Dr.
which was
Ahsan,
asked
are you there?
Yes, yes.
Yeah. So somebody has asked that what is Covertry's competency in EDIC profile? If you highlight.
Yes, Covertry is the standard domain that you have covered. That is Covertry. It's your knowledge, your skill, and your aptitude or attitude. That three part is being tested, both in the EDIC part 1 questions as well as part 2 questions. And Covertry is a guide that how the student should focus during reading. So if you go through the Covertry, you will understand that what component of your knowledge you should have, that what basic knowledge you should have before going to this exam. And this Covertry is not only followed in for EDIC examinations, also for any critical care courses in our Indian Society of Critical Care Medicine. We have to prepare our logbook according to our Covertry this module. Okay. So here you have to read according to those domain. Then what communication skill you must have, what are the technical skill in managing a critical patient you should have. So that guidance is being given in the Covertry.
Remember, this exam is an international exam, and the people are giving this exam from the different part of the world. And everywhere the critical care is not standardized. So Covertry is just as a guidebook kind of thing, where you can understand what are the domain, what are the basic skill you have to have before appearing this exam. Because after this exam, you are eligible to get GMC registration, the Great Britain Medical Council registration. So you are eligible to work there. So that's why they will test in this exam on this guideline basis. So if it is a freely available on the ICCM, ESICM site. So you can download these things. You can go through it. It's a book kind of thing, and you will understand the domain, subdomain, and as Dr. Hassan said, the basic technical skill, basic communication skill you have to have. And another question is DNB DA is eligible for this exam or not? So Dr. Hassan, already you have mentioned about the eligibility. So that's the thing. Yes, Dr.
Yes,
Hassan.
DA and DNB is eligible as primary specialty, but you have to have additional ICU structured course training certificate along with that. So suppose you have done your anesthesia specialty and then you have worked in some ICU. So you must have to have a experience certificate from head of your department. That additional criteria is also needed along with DA or DN.
Hassan, somebody has asked how many years? It is 2 years or 18 months? Critical care experience.
According to the website, the EDIC information, they have given for at least 18 months. If you have more, there is no problem. So minimum 18 months, that is 1.5 years.
So Dr. J. Subho has asked, I'm from Bangladesh. After MBBS, I have completed DA, Diploma in Anesthesia. After that, work as a junior consultant in a hospital for 2 years. May I appear in this exam? I think he can.
He can only, he has to collect a certificate from his head of institution, from the head of the department, that he has also have work experience in ICU for 1.5 years.
There are another question, how much score are needed for EDIC clearance?
They have a lot of calculations. So there is no fixed marks given. It is fixed every year. So they do some logarithm calculation to make it uniform. First, they rule out those questions which are wrong. Then from the rest of the questions, they calculate it around. But around 65% if you score, you should pass. But it varies. Sometimes it is 61. Even sometimes if the questions are very hard, it's 58, 59, or maximum 70. So it is between 65. If you score more than 70, you will surely pass. If it is 60 to 70, then it depends upon that year's questions difficulty level. And it's too difficult, then a score of 65, I think, will surely pass.
Dr. Hassan, Dr. Narmata has asked, he has passed DNB medicine and completed IDCCM exam, both certificate she has. So either she need experience certificate also from HOD or not?
No, if she had cleared IDCCM and she can provide the IDCCM certificate, that is enough to prove that she is eligible.
And 𝑻𝑰𝑷𝑺 asks that he has cleared MBBS and did ICU for 2 years. Now I'm in DNB DA course, so I can keep the preparing for the next exam, sir. Yes, I think yes. If she has the certificate from the HOD, she can apply for the exam.
Yes.
Does Germany accept EDIC for work? I think yes.
Just look at the website and see which countries you can practice with EDIC. But most of the European countries and Scandinavian countries accept EDIC.
There are another good question. Dr. Harsha Gupta has asked, after EDIC 1, EDIC 2 कितने time में दे सकते हैं?
Once you get the pass certificate of EDIC, then you can appear for the EDIC 2.
Yeah.
But if you fail in one session, then you can apply only after 1 year. Suppose you fail in a spring session, you cannot apply in the autumn session of the same year. You have to wait for at least 1 year.
So somebody asks, sir, you will provide only video, and what about the book material? There is a good news that in our app, we are incorporating the e-library, and that e-library will have the book, teaching material, and also there is a question explanation. So we will provide you the e-library very soon. Probably after the month. We are working on it. And someone said, I work in the ICU private sector, sir, so MD can give the certificate. Same thing, I think we have discussed it, that if you have a MD certificate, you are eligible for the exam. Also, MBBS.
MD means MD is not degree, it is medical director, I think, of that hospital. So yes, you will attach one certificate from your ICU in charge and one from the medical director of that private hospital, then you will be eligible.
Yes, okay. Yeah. Okay, thank you, Dr. Ahsan. I think
Thank you, Dr. Asif.
you have
employees of
you
Farz
have covered
Academy
all the aspects.
And thank you all the EDIC aspirant for joining with us.
Yeah, so that brings us to the end of our webinar. Thank you, aspirants, for your attention, and thank you so much, faculties, for attending and delivering such a useful session. I will share the feedback link to the group aspirants, so please kindly give us your valuable feedback over there. Any queries, aspirants, if you have, you can verbally ask to the faculty.
Thank you. Good night to all of you. Best of luck for those who are appearing exam in April.